Professor Ishita Ganjoo, MD, MBA Hospital Administration, PhD Scholar, Associate Professor, Department of Obstetrics and Gynecology, Homeopathy Medical College, Chandigarh, Haryana. A warm, energetic and highly responsible professional having an appetite for gaining more knowledge regarding recent advancement in diagnostics and medicine. He has always been on the top of the academic ladder, achieving many accolades. During study period, received award from Jawaharlal Nehru Memorial Trust for Academic Excellence 2012. And today's topic is a paper presentation on low back pain and its homeopathic management. So on behalf of IFPH, I welcome Dr. Ganjoo. Dr. Dhanesh, did this join?
Yes, she has not yet joined. I just tried to call her. Didn't connect.
Okay.
Yes, we have the number. I'm just looking for my number. I'm not getting connected with her.
Yes, sir. I have called.
If you have the number, you can call, sir.
Yes, sir. I have.
Yes. We know the usual cause of backache in males and females are often different. In case of females, it is often from uterine problems. Then the white discharge, leukorrhea patients are often presented with severe backache. In case of hemorrhoids, it can have backache. In case of males, it is different. Then can have the IVDP, intravertebral disc prolapse is there. Then the rheumatic complaints are there. So according to people and situations, it can be changed. Depending upon that, also the medicine has to be changed. Dr. Dhanesh, what is your opinion?
Yes, most probably most people believe that the backache is due to the bone problems, but actually it may not be. It can be, but it is not 100%. It is. There are different reasons for backache. As you rightly point out, the basic difference between male and female are there, and since there is a difference in the organs inside, the causes are also different, and of course, the reason for this backache is most probably due to the female genital organ, particularly the pain from uterus or ovaries, or sometimes it may be due to the leukorrhea, or maybe due to some descending because of the fibroid inside. There may be it may push downwards, and that may be the reason. We used to say that the fibroid uterus can be one of the reasons for backache. Of course, there are other reasons like renal calculus, and whenever there is some rectal cancer or something like that, that may also be a reason. So that means that we need to go through all these tests, whether ESG and all kind of things need to be done, or sometimes CT scan may be necessary. Very recently, I have a patient who has severe pain in the back, and when I just asked him to go for this USG, there was some trouble with his kidney, but then they went for the CT scan. There we found that there was a big mass in the right kidney, and because of that, there was severe pain in the back. So there are different reasons. Of course, as you rightly pointed out, the hemorrhoids can make a more pain in the back, and that may be a different type of pain. All the as far as homeopathy is concerned, we have to concentrate what kind of pain it is, from where it arises, and how it goes down. Whether the pain comes upwards, or whether the pain goes downwards, or it is from front to back, or from back to front, like that. So in homeopathy, we need to look into the different kind of pain and what are the reasons for this pain. And we need to find how the patient expresses the pain, and what are the things which relieves, whether the person get relief by pressing on the back, or tight clothing, or sometimes light massage gives pain relief, or heavy pressure gives pain relief, like that. All those symptoms need to be looked into, and that will end up with a medicine, and that will definitely be the the exact simillimum for the patient, and that will cure the case.
Yes, Doctor. Yes. We can now invite Dr. Sergi. What is your opinion? Dr. Sergi, are you there? Our guest is not yet joined. Meanwhile, we can have a brief discussion. Dr. Sergi, kindly unmute and interact with this guest group.
Hi.
Yes.
Hi, good evening. But I am very late. I don't understand what did you do. Later, maybe I want to explain my opinion. Thank you.
This is a discussion on the low back pain. And our guest is not joined. It's low back pain and homeopathic management is the topic.
Doctors, our guest of the day in Hindi, Dr. Gaurav Bhatt, sir was talking about sciatica. That is also one of the reasons for sciatica can also happen with the low backache. So, what's your opinion on that, Dr. Gaurav Bhatt, sir? Hari?
Definitely, sir. Definitely, sciatica, as I had shown in my presentation also, that it is one of the prime causes if you talk about orthopedic conditions. Sciatica is one of the prime causes, and I had also talked during my presentation that if you see the prevalence rate of sciatica, so it is said that about 1 in 100 person who are having low back pain, out of 100, 1 person will suffer from sciatica. And this is most common in the age group of 25 to 45 years. And again, it is said that during our lifetime, about 49 to 70% chances are there that we will suffer from low back pain due to any cause. So I tell my students also in the college that don't ignore the low back pain. Many a times in our Indian scenarios, what happens is, for us, होता है, चलता है, कमर दुख रही है, but then when it comes to such severity, then we go for certain investigations, and then in certain cases it is too late. So you should not ignore low back pain, and it should be treated with the utmost priority. That is what is my opinion.
Yes, then we must not ignore the injuries as a major cause. If it's the sports injuries. Yes, Dr. Ganesh?
Yes, Hani sir can add some more points on that.
Definitely, he's the most experienced.
Yes, sir. Yes, sir.
Would you please make him co-host?
Yes, sir. Yes, sir. Is
No, I'm okay. Are you able to listen to me? I
Yes,
was
sir.
Of
trying
course.
to call her, but I don't know, her mobile is switched off and she's not. Several times I tried. Something might have happened. Otherwise, she's always prompt. She has addressed many of the sessions in our both in Hindi and English. So talking about the back pain, I can tell you that I am suffering from the back pain right now. And this happened probably after my fall, and the last 2 years, this pain is not going on. It is continuing every time, whatever I tried, some of the bit. But I'm just narrating you the personal experience with the living with the back pain. This happened, and then I tried with the doctor physiotherapy. I went to the AIMS, and they prescribed me, told me that there is acute osteoporosis, and this is the age-related problem, osteoporosis. It was such a dangerous level it was. So they advised me to take some, add on some vitamin D and sit in the sun. I followed the advice, and they also prescribed me some physiotherapy. I did the physiotherapy, and gradually this pain reduced. But along with this pain, I think this is not only the osteoporosis that is causing with this associated with this. This is another thing that, because most of the osteoporosis cases, they are suffering from the back pains, and especially in the lower back region. And this situation happens because of the lifestyle disorder. Definitely I am a lifestyle disorder. I'm not a well-planned life personal, because I have to do hectic job, hectic engagements are there. So with this hectic individual, but the understanding is very important. I tried with looking for these medicines, and I observed in myself, along with the association with some of my colleagues, about the appropriate medicines for me. So initially I took the Ruta because it was related to the injury, and it gives some relief. And then the first medicine that I prescribed was the Arnica for myself. Arnica also subsided, the immediate relief was there, but it didn't well. And with the Ruta also, it didn't help me a lot. But of late, I discovered about the Pulsatilla about me. Now, just see, thinking about the Pulsatilla for this year. One thing that is also associated, I found that whenever back pain is there, there are some accompanying problems are also there. And along, all the back pains is not simply because of the back, local region. It is also because of something that is associated with this. And another most important things that is associated with the gastric disorders is also. So irritative bowel syndrome, this is there. I also observed that by it. And Pulsatilla. Pulsatilla, I started with 0/1 in LM potency. It gives me great relief, and gradually, and now the pain has reduced to such a level that I'm not experiencing it so severely, and I can perform all my activities very properly. So just looking away from the pain. And when you think about the pain, whole mind is get concentrated on the pain. But ignoring the pain, and I look for the life situations and life understanding. And with these things, you can discover the pain, because pain is only the representative figures, and it do not tell you everything about the thing. But behind the pain, what is the reason? Causative factors are important. So, and causative as well as the maintaining factors. Causative factors, I knew that it was an injury, but what is the things that is not allowing to heal that injury, and that background. So this is the concept that Dr. Henneman has given to all of us, that something underlying factors are there, and that has to be looked first before we try for looking for the medicines. So underlying factors, and I think this is the only thing that helped me to discover the Pulsatilla. So whenever a patient complain of migraine or this arthritis or gout, any type of the pain, I simply ignore. Even in the cases of fever, the patient say, I have high fever. What is the problem? What is, if you concentrate your mind on the fever or on the pain, you are not going to get any of the medicines. This is this I have experienced with me. You have to look what is the things, what is the maintaining, what is things behind that, because pain is the reflection, it is the outcome, it is the subjective message that is being given to you to the person that there are something wrong. So discovering this wrong things is important. Discovering the wrong part of the ring, and that will give you the right medicine. So, and this similarly, this things is very much applicable for the all the back pains. And what I heard, I have talked to Dr. Ishita about this low back pain, was that she had made some paper on it. She had made some clinical research work there at her college, because she is also very much involved. She, along with some of the her colleagues, they are doing a lot of good work in making a research work there in Chandigarh Homeopathic Medical College. So she only wanted to present the scientific paper in this webinar. So friends, what I feel, instead of looking for the pain, instead of thinking about the pain, look for the things which are causing the pain. And even this will help you in this treating all type of the cases, including every chronic and acute illness, every type of that thing. So this, I think, someone more suggestions may come up from a lot of persons we have here.
Yes, definitely. This is platform for sharing experience. Definitely, so those who are participating in this program can have your own opinion. You can share your experience. Hariharan sir, are you there? Yes.
Dr. Hariharan, I think you can explain us a better way. You have a lot of experience in this type of the cases. And especially the old man like me, they have got a lot of experience regarding the pain, and especially we all suffer from the back.
Okay, sir, what you said is correct. Now, see, osteoporosis is one of the best main reason, and we give the vitamin D, and see, yeah, even after giving vitamin D, or along with vitamin D, I will give the calcarea force and see other medicine according to the symptoms. See, concomitant symptoms is very important while treating the back pain. A lot of reasons for back. There is some hemorrhoid patients will have this back pain. That everybody knows that is one of the main remedy for back pain. See, prolapse of disc, that one of the main reason for this back pain, collapse of the disc. And this see, it is commonly it is an old age problem. And see, I have once this back pain, and see, the symptom is that while I can't move for while I am going to the morning bath, that cured by bryonia, simple bryonia 30 give me the relief. And if anytime that pain came, I will take bryonia, different medicine for different persons. See, my daughter have the back pain, severe back pain after her delivery, and consulted that several persons after the delivery, and they said that they can't possible to cure the relief, they are giving some say painkillers. But the exact reason was that for her delivery, they injected their injection, they gave for anesthesia, and that done the harm, and she became this, she got the pain. And I gave the arnica, but no effect. I gave arnica 10m, up to 10m, no relief. But I gave hypericum and Bellis perennis. Hypericum followed by Bellis perennis. Completely cured, and she got best relief, and there is no problem. See, such a ways. See, certain persons have this spondylosis, that then they have the back pain. See, I am usually giving this for this back this type of back pain. See, Lacranthus, one of the best remedy. See, calcarea floor, high potency. I mean, calcarea force, high potency, along with the calcarea for 6x, give best result for certain back pain. See, we must differentiate the pain according to the positions also. See whether it is coming from the neurological disorder or the muscular pain. For muscular pain, we must it's every muscular, there is a muscular pain, there is a specific medicine for in homeopathy. And if we give that such medicines, that the symptom will be cured. So a lot of reasons for this back pain. So others can contribute. After that, I will also contribute for this.
Sir,
I will comment for that.
Could you give some medicines, your experience? What are the medicines most probably used? That case,
Usual medicines, and that I said for muscular pain, and I will first I will differentiate whether it is this pain is coming from the that from the spinal cord or from the muscles. Directly comes. Muscles for just, I will give usually belly aspirin is one of the best remedy for that. And see, must for this is in case of from the bone, regarding this affect, when it affects the bone, I will give the calcarea force, one of the best remedy. Calcarea force high potency I am giving, and see, along with that calcarea.
What about the using of the nosodes in this type of the cases? Can anyone say? What I have also observed for the nosodes regarding the chronicity and to remove the chronicity, the background, these nosodes are required for the back pain also. And there was a case of this back pain with me, and it was being treated severally by the different practitioners and myself also, and I was not getting any of the medicines there. Then I thought about the lifestyle and other things. Then in my mind it came that the patient may be suffering, might have suffered from the tuberculosis. This was my assumptions. So I asked the patient whether you have suffered from tuberculosis or not in the past. He said, no, never. Then but the symptoms was just related to like that. So I went for the reports, the laboratory investigations, and it was, to every surprise, there was a tuberculosis test was positive. But there were no symptoms at all. In these cases, along with the other symptoms, I also don't prescribe the medicines directly on one indications. I use to get it associated with other symptoms also. So I selected the tuberculinum medicines, and within 1 or 2 months, the pain started reducing to much extent, and thereafter the other medicines, which was the constitutional medicines for her, she got completely recovered from that back then. So removing the obstacles. This is also the message of Dr. Henneman. You have, when the things are relapsing and it is not moving, in spite of prescribing the right medicines, you can think about the. So this, can you say that tuberculinum is the medicine for the back pain? No, but in homeopathy, we cannot say any of them, and we cannot brand any of the medicines to be specific for this or that condition. It is related to either to the situations and either to the totality or the constitutional factor of the patients.
Yes,
Yes, Dr. Manu, you wanted to say something.
Yes, we know that it was a very prominent or dominating disease in the last century, around 1900 and 1950s. A lot of tubercular patients are there. Still, around 20-21% of persons are in fact affected with tuberculosis. It's a fact. Then again, you said the another is sitting on cold pavements. The Naxomica symptoms. Then after the anesthesia, spinal anesthesia, patient can develop this backache. Then excessive strain or sprain from stretching. Rustock is the medicine. Then Rota is another medicine. Then the lobelia is the medicine. You cannot sit straight. Calicar, weakness, sweat, and backache is another medicine. So hundreds of medicines. That is the most beautiful aspect of this homeopathic medicine. The physician has to think twice or thrice before prescribing medicine. Dr. Sergi, are you ready to share something, Dr. Sergi?
Yes.
Yes.
I understood. Thank you so much. Maybe I want to add some knowledge about my patients, and he has a very big back pain, and came to me. If you have find solution, he must go to the operation because he has a disc hernia. But I want to learn something about the currently problems. Yes, it is L4 and 5 disc protrusion has, but at the main symptoms of that, he has a very big grief because of he has divorce and he has some big problems, and for years he has many problems and children problems, and after that very sad and don't see anybody and any company. And at the same time he is a doctor and he is a gynecologist, and I want to see a natrium muriaticum pictures and give him, and just 2 step only walking, but after treatment and walking and jogging after that, and go to the hospital, and 2 days later he go to the he doctors I said he operation his patients. It's a wonderful solution because the main cause is very big grief. And it is wonderful. 2 years later, he come back again, and he said me, I hold a big big weight, just like this, heavy back, and after that again back pain, but this time again MRI, but the L5 sphere disc hernia, and I give him the main symptom is the same, and he has a big grief again, and I give him again another muriaticum, and he is fine for 9 years. He has no any other pain or any other problems. Thank you.
Yes, that's a nice case description. That kind of approach is the most important thing, as you said about the constitutional medicine or the deep active medicine. Definitely, we know that is Sahani sir said, to cause a disease, to continue it for years and progress it day by day, definitely the presence of miasm should be there. Otherwise, these are too insignificant to cause a chronic disease according to Hahnemann. So that's the most exact method you described is the homeopathic method. Sahani sir, what is your opinion?
Yeah, definitely. Sir, I agree with you. And I would like to say that regarding the causation, one of the important causations which is very much common in the female cases, after the childbirth,
Yes.
after the delivery,
Yes.
and a lot of the females who don't have the understanding about the proper care after the childbirth, they suffer for the from the back pain. This is also very we have to keep in mind. Then another thing is that about the back pain is about the styles of living styles. So all these factors are the contributory factors for the back pain. But very much prominently the after the childbirth and after getting hysterectomy, and in the cases of the surgical and even the appendectomy and gallbladder removal. All these cases I have observed after the surgery was done, the back pain and the other rheumatic type of the pain started. So what I was trying to think, my hypothetical understanding for this came as there must be a gravitational disbalance being caused within the body. We all have a natural, along with all the organs at proper place, we have a gravitational force are working in a proper way or balanced way. But whenever an organ is removed from the body, organ, at whatever place it may be, it causes an imbalance in the equilibrium of the whole thing, phenomena. And this is also one of the major cause that you can see if you have in the cases of the patient who had undergone some surgery. In the male, the gallbladder surgery or the appendectomy surgery, appendix surgery. The major causes are like this, and they are suffering from the back pain. So this is only a matter of understanding and your consideration. And when you consider these three features, you can get some of the, because now you cannot bring back the organs, but you have to make a management of creating a balance of the harmony of in the balance of harmony and balance of the whole economy of the patients. This aspect needs a lot of consideration in those patients who are given right medicines. We feel that this medicine is right, it is constitutional, but it is not working. Why? Because we are not able to correct the balance situations, the economy of the whole phenomena. Man is complete when all his organs are present, all things are present. But one organ or one part of the things is missing, he is not a complete man. This understanding I developed.
There is another reason, sir.
Yeah.
According to H.R. Roberts, it's often said that these surgeries often cause suppression of the psychosis, miasm.
Yeah.
That is the whatever way or wherever it is done, definitely the patient will develop more and disease to more organ. Then another one is this abortions. Abortion is a major cause in backache.
Yeah.
In the kidneys, labor, and abortion. In case of Kylie carb is number one medicine there. Hariharan sir, now I think sir is ready to give some feedback now, right, sir? Yes, please. Please unmute, sir. Yeah, sir, unmute, please.
See, Manoj, what Manoj said is correct. Usually, the pregnant women have the backache. That see, Kali carb is one of the best medicine. See what you said for after abortion, Kali carb is good, and for pregnant ladies, Kali carb is very well. Backache with see oxalic crystals in urine. See, such patients we can use oxalic acid 200. Use it oxalic acid. Oxalic 200, that will give best results. See, sometimes the certain patients have the backache with burning. That phosphorus is one of the best medicine for phosphorus. That in my experience, and the certain backache with the stiffness, agaricus is the best medicine. Agaricus. See, certain cases with a sudden crack of the back. Such patients, if we give the Actia racemosa, that will do very good for the patient. See, backache with pain in legs, transferring to the pain to the legs. Variolum. That is best medicine. See, certain patients have, the patients will say to us that weighted back at a coccyx region, weighted back. Antindart is the best medicine. Antindart. Already we discussed that one. See, with the constipation, backache with the constipation, that Naxomica, hypertension, usually I am giving, and they will get good results. Say this Pulsatilla we can give. See, during the menstrual period, if backache is there, that Pulsatilla usually we give Pulsatilla and give good results. See, Bryonia, see that according to symptoms, Bryonia and Rostox, we usually every homeopath uses and give good result also. See, arthritis, one of the main reason for backache, arthritis. See, arthritis, we are using several medicines. Medicines we are using, Rostox, Bryonia, Causticum. These are all medicines. Causticum, that very good. Usually, if the edema exists, we must feel the back. And if the edema exists, I am giving for acute cases EPIS 3X. I am giving now. See, numbness. If the part shows some numbness and night pain and sensitiveness, that chamomilla is one of the best medicine. Chamomilla. See, next is no gouty patients. If for gouty patients, we can use colchicum. Colchicum. Then tartaric acid can be used in the patient pain at heel and feet. Such patients we can give the tartaric acid. Certain patients have a swelling at the great toe. That great toe, that eupatorium. Eupatorium, one of the best medicine for bone pain. Total bone pain, eupatorium. If the other symptoms agree, that eupatorium will do very much effective. Just is pain at elbow and knee joint with the swelling. See, salicylic acid is the medicine. These are all acute medicines. These are all acute medicines. See, if any deformity, usually I am getting such patients having bracket legs, and they will have the spinal pain, because see what Sahani sir said is correct. The gravity, total weight is transferring to the earth by our legs. But if the leg shows some deformity, they will have the back pain. That is usual cases comes to our OPD. Such patients I am giving picric acid. Picric acid is one of the best medicine. Now, constitutionally is the best way to treat it, but in certain cases we must give the acute medicine also. Calcarea, constitutionally calcarea, silesia, phosphorus, the calicor, these are the medicine usually I am using. This see, the pain comes along with the tonsillitis. Chronic tonsillitis patients sometimes come to us with back pain. Such patients I experienced with Barretacar, 10 ml. I got best result.
Yes.
Barretacar with 10 ml.
So on the last day, we have a discussion by Dr. Padmapriya. She said about this bambusia. So the bamboo spine, that is also a major cause of this back pain. The patient cannot move properly. The stiffness of back is another symptom. Then again, in case of this oxalic acid restraint symptoms there, when thinking, it will aggravate the back pain. In case of, then you said about the variola, that is also wonderful medicine for this severe backache. Variola.
But the pain transferring to the leg, that is one of the main symptoms of variola.
Yes. Then you said about this colchicum. Then we must discriminate between colchicum and the Staph aureus. Both are often complaints from words or misdeeds of others. Generally, mostly we consider only Staph aureus, but colchicum is also having a similar symptom. Misdeeds or words of others, often least misdeeds.
Very correct.
Major rheumatic medicine.
Colchicum is coming always for gouty patients.
Yes.
And if we examine their blood, the uric acid is will be increasing, and the RA factor will be positive. Certain patients have sometimes RA factor positive.
Yes,
Such
sir.
patients.
Dr. Harihar, can you say something about the berberis, important berberis in such cases?
Okay, correct. Berberis.
Berberis is also important.
Berberis. Very good remedy.
Yes. Dr. Sergey, What is your opinion? Use this in the comment box. The Santos Island, please, Dr. Sergi. Yes.
Yes, Santoxolium is important for pelvic pain because I have a young a woman. He has a head pain in the mass before and at the same time before masses, and he has a pelvic pain and extending to the hip and the lower extremities, and he has not sit very comfortable, every time very restless and sitting. She is sitting time, but very restless, and at the same time he has the masses. Hemorrhage is a stringy hemorrhage in the masses. It's very important. Xanthoxylum, very good result for her.
Okay. Then about this maintaining a good posture, healthy posture, that's the most important thing. The most
Very correct.
probably maintaining cause. Then
Correct.
again, you must walk more than your usual custom, as advised by Dr. Samuel Hahnemann. Those who are always working his brain, the intellectual activities who are doing, definitely, just like doctors and the IT professionals, must walk more than their usual custom, as advised by Dr. Samuel Hahnemann. Sahani sir, what is your opinion?
What I feel, sir, I would like to add more
Yes, sir.
about the nature of the pain.
Yeah.
Because the nature of the pain is also important to consideration, and how they appear and how they go, and the modalities. These things gives you the brings you the closeness. There are some patients who the pain starts gradually, it reaches to the peak, and then it starts receding. So this is a paroxysmal type of the pain, and then again the periodicity is also important in this case, and the situation, postural positions like having pain, there is no pain at all right now, but as soon as they start walking or movement, the pain starts. So beginning of the motion, and then it again better. So change of that is also known as the inertia. The stages of the inertia is another big cause for the back pain. And when we think about the inertia, the first medicine that comes to our mind is Rastox, as well as Nux vomica and the Pulsatilla. They are the medicines which can break the inertia. So breaking the inertia is important, that in the cases of the all type of the situations where the pain is existing. This is also important things that when you have to look for the pain. I'm talking in reference with that back pain, but it is applicable for all type of the pain that is available.
Very
Yes.
correct. Very correct.
It
Certain
makes-
sir,
it makes-
what you Sagani sir said is very correct. See, the certain typical pains.
Yeah.
We have we have in our mathematical right remedy. The pain comes suddenly and goes suddenly.
Yeah, definitely.
Definitely. As one of the best medicine is belladonna.
Belladonna. Yeah.
Belladonna suddenly comes and suddenly goes. Then certain symptoms, some electric like pain.
Yeah.
Electric
Jerking pain. Jerking pain.
electric like pain. See, and the patient jerks while that when the pain comes, she will jerk, like, or he will jerk. One of the medicine is never Metromedica, but now I am not remembering. I see. Once I gave that medicine and cured a case also. Electric like pain. That in Metromedica we have. Sir, are you
when
remembering?
you think about the, sir, Dr. Hariharan, can you say that electric like pain, one of the prominent medicines that I have understood is the hypericum.
Hypericum.
Hypericum. Very beautiful thing, medicines that I have. And I saw that this hypericum to be working very fastly because the pain, jerking pain is usually associated with the nervous system, neurons, nerves, and its slightest jerk give the electric shock type of the pain. So, and for the neurotic pain, hypericum is one of the good medicines that we can think of. Hypericum, although it is a plant-based medicines, but it is one of the good things that when we think about this type of the
This sensation
stinging
and the
pain,
kind of
jerking pain,
Yes.
and then another pain is nauseating pain.
Okay,
Nauseating pain is also there, and that one patient came to me with a pain, and it was weeping. I say, what happened? But instead of saying something, he was crying. So I took only one symptoms, weeping with the pain, and it is in the mental repertory, weeping of the pain, and the medicines that came out for me. There are 5 or 6 medicines are there, weeping with the pain, and I selected the Pulsatilla, and Pulsatilla cured that case again. See, weeping with the pain, because it is affecting the status of the mind, and that which is touches the very sensitivity of the mind. Another type is the jarring pain, jerk. Cough
pain.
gives you the sneezing, cough, loud talks. They are also indicative of the pain, very sensitiveness, and which is very much associated with the inflammations of the nervous system. And Dr. Dhanesh, you are silent.
Yes,
You
sir.
have to say something also.
Yes, sir. It's exactly what a kind of beautiful discussion going on, and that's why I was just listening. And some of our presentation some day back, Dr. Prakash Rao in his lecture told that the Rostok's 30 really works in a beautiful way in rheumatoid arthritis condition, particularly in the back pain. And when they undertook the research work on that, more than 70% of the cases were successful with the Rostok's. That was one observation. And he is a person who undertook such kind of research work for the CCRH as well as his personal work also. That is really a very good thing. Whenever when an acute emergency arises, when a patient is undergoing constitutional treatment, you are not getting properly relief, then suddenly a patient getting pain, aggravation of the pain. At that time, you can use these Rostok's as an intercurrent remedy in those situations as far as his observation. And I have experienced so much of relief to patients in by using that technique also. And that's what I would like to add. Of course, as you rightly pointed out, hypericum tendon also works in those conditions where low back pain is persisting. And Naxomica 30 is also a very good remedy for those who are sitting, always sitting like Sahanisar and me, and those who suffer from this arthritis. Most probably, in those conditions, Rostok's as well as Kylie also works well. And graphitis is also very good, as we know that most of the people who are having very fatty in nature, and in those conditions, this graphitis as well as lycopodium and this calcarea works way in a good way. These are the things I would like to add to this session.
Definitely, these are the individualistic symptoms.
Just
These
now
are treated as personalized
one
medicine.
thought came to my mind.
Yes, sir, please.
About the ghost pain. Have you heard about this ghost pain?
Horse pain.
Ghost, G-H-O-S-T.
Ghost pain.
Horse,
Have you heard about that?
horse pain.
It
Not heard,
happened
sir.
in 1990s.
First time we are hearing.
Just I'm going to narrate a story. It happened in 1990s, 1919 or 89 or something. My father was having the cerebral hemorrhage, and after that he was paralyzed, and he was unconscious at that time after the hemorrhage, and he was in the ICU. And luckily, with the help of the homeopathy and the lachesis, I remember the lachesis medicines, I was allowed to prescribe the homeopathic medicines along with their care. So lachesis helped, and he gained the consciousness, and he was put back into the general ward, the private rooms. And whenever I go to there, my father used to teach me something, lot of about the repertory. So he just talked at that. He called me the Munna. Have you heard about this ghost pain? I said, no, I'm not aware of this. He said, ghost pain are those pain which is not there and which is not associated in the part, like a person who has been amputated with the legs. Now the patient complains that the pain is there in the amputated part. How it is possible? How it is possible? And he asked me to look for the appropriate medicines in the repertory, and he pointed me the page number, and I'm not able to recall the exact medicines what he told and what I saw in the repertory. But
Sir,
it was
is
there
it
in the report.
Aliasappa is it?
Yes,
Yeah.
most probably.
Aliasappa.
LMC, sir, I'm not remembering the name of the appropriate name of the medicines, but I'm telling you this ghost pains, it is also happening. And during my clinical practice, in some of the patients, I observed this type of the pain. And the rubrics is working. There are, I think, 4 or 5 medicines listed under that. I'm just not able to recall properly about the exact name of the medicines, but it is there. And patient used to complain about the pain, like ladies, female, hysterectomy is gone. Doctor said, there is a pain in my uterus. Where is the uterus? No uterus is there, but he's complaining that pain in the uterus. Because that sensation, even after the removal of the part of the body, the sensation persists. This is the message what I got from my father. Sensation persists, even the organs are not there. If your hand is amputated, whatever part is lost, that part, even they are not there, they remain in the memory. So memory, the pain which comes through the memory and not related coming from the neural region, they are called the ghost pain.
Sir, there is one medicine, neuralgia after amputation. That is Aliasappa.
Neuralgia is different, sir. It is not the ghost pain. Neuralgia is there. The injury to the nerves, and then nerves get inflamed, so neuralgia will be there. And that are the common phenomena where hypericum and some vomica, arsenicum are working well. But this ghost pain is completely absent for related to the. Someday I can, next day I can refer to you the name of the med. I'm just forgetting this right at this moment.
Okay, sir. Yes, this is a condition. As I said, this is known as phantom limb. The part is removed, but the patient feels that part is there, and he feels
This is the sensation.
Yes,
sensation.
recently I got a patient. His arm is amputated, and he got a pain there. I just prescribed this Aliasappa and was relieved. So Aliasappa is the number one medicine. It is known as, the condition is known as phantom limb. PHANTOM, phantom limb.
Phantom limb.
Yes, it is called.
Phantom pain. Yeah, phantom is also the right word.
Yes, that is the condition. Then the hypericum is a wonderful medicine. Bovista is another medicine. So thousands of medicines are there. Acid sulfuric is another medicine for injury. Ledam is another medicine. So we are not at all. Yes.
We can put one of the class regarding the pain itself. Several type of pain is in our materia medica.
Okay.
Definitely, we can have a discussion later, sometime later.
I think we should make a session every week, once a week, this type of discussion. This gives you a very fruitful understandings. Dr. Dhanesh, can you think about this?
Yes, sir. That's why we put 15. We reserve 15 minutes for discussion every day, because those every doctor can add something more on the presentation itself.
No, I think that we have talked many things about the back pain. What one speaker might have talked.
Okay, sir. Yes.
Way that
Sir,
we can
please
think
trying to
of
wind up the session, sir. We can continue this discussion. Definitely, it's a fruitful one. In the coming days also can have some discussion. So with that remark, let me conclude today's English edition. Hope you to meet the same time tomorrow. Till then, goodbye. And over Dr. Shaila to continue the program in Malayalam. Thank you.